Hi, everybody. Mohab Hanna here again. For those of you who don't know, I am a child and adolescent psychiatrist, and I want to talk directly to you kids who are middle school, high school kids who struggle with anxiety. And we're in the midst of this whole coronavirus situation, and a lot of people are talking about anxiety and how people are coping with this, and how kids especially are coping with this. But a lot of you watching this struggle with anxiety already. This is not something new for you. This is something you've been struggling with for a while, for some of you years, for some of you months. Anxiety does not feel good. Anxiety stinks. It's overwhelming. You feel stressed out a lot. You worry a lot. You're not sure what's going on. You're not sure what's going to happen. Little things throw you off. You get uncomfortable a lot. And the temptation a lot of times for you is to either avoid or to shut down. So I want to talk to you about this because I want to encourage you. And I want to encourage you in several ways. First, yes, we are in a situation that is hard, and you're all in home instruction right now. But I want you to know that your anxiety doesn't own you. In other words, just because you struggle with anxiety, and even in this situation, that's not what you're about as a person. Yes, you're struggling. Yes, you don't feel good. Yes, you're worried about all sorts of stuff. You're worried when you're going to see your friends, or you're worried if something's bad's going to happen to a family member, or you're going to get the virus, or you're not going to get the virus, or when school's going to go back, and so on and so forth. Some of you even get anxiety attacks. Some of you get panic attacks, as you've been telling me, or some of you can't stop thinking about this. It doesn't own you. It doesn't define you. It is important to remember that anxiety by its nature has a tendency to want to dominate you, has a tendency to impact how you view everything. It distorts your ability to see things clearly. It's like my glasses here, if there's a lot of junk on them, then I can't see clearly. Anxiety does the same thing to your thinking, and then it affects how you feel. And so you got to recognize that. You got to recognize that anxiety is not the most accurate way to see yourself or your world. And then the other thing that anxiety does says, I gotcha. I own you. I'm going to control you. I'm going to paralyze you. Just because you're feeling that way, and just because anxiety is telling you that way, does not mean that that's true. You have the opportunity to recognize that just because you struggle with anxiety, that's not what defines you. That's not what controls you. It is important to recognize what happens when you get anxious, that you're not thinking clearly, that your thoughts are distorted, that they are not accurate to the situation. Your mind goes to the catastrophic, to the worst case scenario a lot. Oh my God, this is the worst thing that's going to happen. How am I going to handle this? I can't deal. Actually, you are capable of dealing. And here's the nice thing is you don't have to do this on your own. And I'm not talking about seeing a counselor or a therapist. I'm talking about you got people around you. Don't be embarrassed by having anxiety. You don't have to be ashamed of it. Yes, anxiety stinks and doesn't feel good, but it doesn't own you and it doesn't define you. And you got to remember that. Anxiety distorts your thinking and it messes up your ability to see things clearly. And you got to know that. I hope that helps. I'm going to talk about this, about some strategies and things in other videos, and maybe some of the other therapists in our practice will also. All right. Bye.